is one of my dear closest friends, and she is going to be, oh, she's going to have a lot of amazing information to share with us today. So just most of you I've seen in the weeks past, so thanks for continuing to join us every week, and you know the drill about muting yourself or keeping yourself on the screen if you are comfortable or not, and then just chiming in via chat or raising your hand if you have a question. So I think we'll just jump into it. I am so excited to have Emily here. She's going to be speaking on avoiding injury and strength work for the cyclist. We have spent many, many hours on the bike together and running, swimming, all kinds of anything athletic. She's super talented. She has run a, I think, 251 marathon. Is that right, Emily?
Yeah, 250.
250, yes. Sorry. So super fast runner, super fast cyclist, but she also is very accomplished in her career. She is a physician at Stanford in orthopedics, children's orthopedics, and has a special interest in female athletes and bone health. So I am delighted to have you here today. Emily, thank you.
Thank you, Laura. Thank you, Catherine. Everybody, hopefully you can hear me okay. I am currently in my Sunnyvale clinic location and found a spot that was socially distanced so I don't have to wear this thing. And I'm really excited to be here. I didn't realize this was the last one, so I'm feeling a little extra pressure. But I have a PowerPoint just to help explain things, give you some visuals, break up some of the monotony with a couple of fun memes and GIFs and photos of yours truly, Laura, and myself. So I'm going to share my screen. Let's do this one. Okay, and then I lost you all. So we'll do that. Great. Can everyone see my screen? Yes? Okay, awesome. So as Laura explained, I am a sports medicine physician. My background is in a field called physical medicine and rehab. So as it sounds, there's a lot of emphasis on maintaining the functional status of the athlete and really looking at the athlete from head to toe, which I really love. And I have a particular interest and passion in endurance sports medicine, so the cyclists, the runners out there, the weekend warriors, and so I'm really excited to be able to talk about a lot of those topics today. And so this is the Cyclist Guide to Reducing Injury Risk While Getting Stronger. This photo is of a friend of ours, Sarah Headley, who gave me permission to use this, so I didn't just steal it from her Instagram, but she is a strong cyclist and a really good example of how we can stay strong on the bike and reduce injuries in the process. All right. There we go. A little bit about me. As Laura said, I got started as a runner at heart, but had my share of wipeouts and injuries along the way. And that introduced me eventually to the bike, which you hear a lot, and people go from running to cycling all the time when they develop an injury. And yes, a nice close-up of one of my injuries. And I love cycling. This is a picture of Laura and I riding along Highway 1 near Big Sur. Another one up the coast. I'm fortunate to live in California where we have a lot of coastal riding, and recently I've gotten more into gravel riding, and I have a really fun gravel bike. So here are some other photos. Disclaimer, I love the dirt, but I still have a lot to learn in the dirt, and which is why I'm not giving you a lecture on skills. Let's see if this will play. Entertainment number one of the day. Not my finest moment, but as you can see, I am smiling, and really it's a humbling experience being introduced to new sports. But I think that there's a healthy way to approach your time on the bike and really try and make it a lifelong sport for all of us. today's goal is that we all learn. We learn something. Hopefully you can walk away with some new information. This isn't just old news. I'm sure you're going to hear a lot of overlap between some of the talks from previously. But my primary goal is to talk about the most common medical and musculoskeletal issues affecting the female cyclist in particular. And then, review prevention and treatment approaches, and then allow for a lot of Q&A, as much time as we can allow. I liked this. If time is money, money is power, power is pizza, and pizza is knowledge. But really, I was trying to get to knowledge is power, but you can see that is speckled in there somewhere. So before we get started, these are tips for all training levels, all ages. I tried to pull evidence from reputable sports medicine journals, studies, and my own personal experience just as a practicing physician. And please ask questions throughout. I'm don't know how to make the chat function. So Catherine, I'm just gonna have you like wave at me or just chime in if there is a Q&A, some questions that come up. Okay, so cycling related injuries can be broken up into two types, traumatic and non-traumatic. So I could talk about traumatic injuries, but I don't really want to or need to. And I think that there have been some great lectures or talks on just skills, and I think that's really where you can build and try and prevent some of those traumatic injuries on the bike. But non-traumatic can be broken down into bicycle contact injuries, so interface between the shoe, the saddle, handlebars, as well as other overuse injuries such as the knee, back, IT band or iliotibial band, and Achilles tendon can also flare up on the bike. And those are what I'm going to focus on today. So a quick PSA plug on helmet use. I know all of you, I hope all of you are consistently wearing helmets when you're on the bike, especially right now. We want to avoid being in the hospital. I was actually reading in the Facebook blog about a cyclist who did have a crash and hit her head, cracked her helmet. This imaging, brain imaging was negative, and I think it's really important to know that even if a CT scan is negative for a brain bleed or there's no evidence on imaging, that doesn't mean that that athlete doesn't have a concussion. And there should be some measures taken to ensure that that athlete doesn't just get back on the bike, even whether it's within the next day, even next week. Because a lot of times those symptoms will take some time to really present themselves. So maybe an athlete feels fine or a cyclist feels fine the next day or the next couple of days. It may take later that week where they really notice some symptomatic differences. So I really encourage you to be careful and take those injuries and those crashes seriously. I mean, not every crash and wipeout leads to a concussion, but you don't have to hit your head to have a concussion. And I think that's sometimes a misconception or misunderstanding within head injuries. Helmets have been proven to prevent skull fractures and intracranial hemorrhages, but there isn't evidence that it actually prevents concussions per se. If there is concern for concussion, call me or send me a message and I'll try to answer and help you field or navigate. Of course, if it's at a race, I recommend immediate evaluation by a licensed healthcare provider. If not available, that cyclist should be removed from the sport or the event with a referral to a physician trained in management of concussions. And they can be really troublesome for an athlete. And I think, unfortunately, a lot of it's because of mismanagement early on in the concussion, maybe trying too much, or maybe they're not doing enough. So figuring out how to navigate and doing the right amounts of movement that's going to help facilitate brain recovery while avoiding aggravating the symptoms more and prolonging the recovery. All right, so we're going to dive right into it. So knee pain. I feel like we have all experienced knee pain at some point in our life, likely on the bike. I liked this meme. Went to the doctor because my knee was sore. The doctor confirmed my worst suspicions. I have a sore knee. Unfortunately, I feel like that does happen, especially maybe if it's not a specialist. the diagnostics, or sometimes a physician will just say, well, we'll stop doing the sport, or stop riding, or stop running, or stop doing something that you love to do, and that can be really disheartening to hear. So knee pain is the most common overuse injury seen in the cyclist. Leads to the most time lost from sport. And, different types of knee injuries include IT band syndrome, patellar tendonitis or patellar tendon injury, quadricep tendonitis. So those are certain parts of the knee, and I'll just kind of show you some pictures. Patellofemoral pain syndrome, and then kind of inside of the knee pain. So what are some potential causes? And I really wanted to kind of get into some discussion on training, especially during COVID, during COVID-19. And I think a lot of athletes are trying to figure out how to address or adjust their training to accommodate this unknown in races, but also maybe more time or different time than they usually have. So their causes of knee pain can be caused by a rapid increase in intensity, mileage, or even terrain. So too long, too steep, too soon. And of course, like pushing big gears, so maybe different gearing, maybe different bike, and terrain. And I definitely noticed this when I have been riding a lot more steep stuff, and it's a new introduction or a new stimulus for me. I can feel the extra contact and compression within my knee, and thankfully it doesn't lead to prolonged pain, but I notice I can even connect the dots that could be a potential aggravating factor if it was a prolonged stimulus. And then, of course, positional. And I believe that there was a bike fit, some degree of a bike fit discussion or lecture webinar earlier. So I won't get in, and I'm not a bike fit specialist, so I'll kind of definitely admit that. But different positionings of your feet and your toes pointing inward, excessive knee motion. You can kind of see that. I mean, you watch cyclists and you can kind of see that excess motion within the knee, and you can imagine over a century ride how that could really be an issue, especially if it's a new distance. And then saddle position, of course, too. So this is just a nice example. I think you can see my arrow of that knee dropping in. And there are a number of reasons for that angulation. So it could be something with the positioning or the bike fit or the pedals. It could be because of weakness within the hips and the glutes. And oftentimes, I feel like we attribute some of our knee issues like, oh, our bike fit, it's off, or we need to adjust to saddle position, when it really is something more, oh, it's with my strength or flexibility or a combination of those things, and that really needs to be addressed to fix the underlying issue. And here's another just kind of different types of angles. Of course, you get into that lower saddle height, and that's going to lead to that knee flexion, which can then cause. So this is a nice, very scientific picture of the side of a knee. So you can see the femur here, you can see the tibia here, and then you can see the kneecap here. So you can imagine, so if that angle is greater, so greater knee flexion moments, that kneecap is going to compress in, and that's going to cause potentially extra contact forces underneath the kneecap. And that can, over time, lead to a lot of inflammation and irritation. So that's something to really keep in mind with your bike fit, and keep in mind that that bike fit might evolve as you start to ride more. I'm just going to take a quick TV timeout and make sure that there aren't any. Okay, perfect.
Good. Mm-hmm.
Great. Okay, so I want to take this time to talk about how important our hips and glutes are. We think about cycling oftentimes in a very linear, single plane fashion, but there are a lot of other accessory muscles that need to be firing or engaged or stabilizing to really make sure that you are staying as stable on the bike but it's also going to help with overall performance measures, and ideally also prevent some of these aggravating kind of lower body, lower leg, and back issues from really kind of rearing their ugly head. So you can see deep within the pelvis, there are all of these muscles, and they all work to rotate the hip and rotate the legs. And in addition to that, they work to kind of stabilize and keep that pelvis in place. And so you've got some deep muscles here that some people complain of some achy piriformis, but you can see that it may be more than just a tight piriformis or painful piriformis. It could be part of your glute muscle. It could be some of these deeper gemellus muscles, quadratus femoris, and you can even get impingement of some of these muscles. And it kind of presents as this like really deep achy pain in the glute that's really sometimes hard to localize. And oftentimes the management is the same. So usually we don't stress too much about identifying the specific muscle, but there's a lot in there. So you kind of take a layer out or kind of go to the next layer and you get some of these really important hip flexors. So the iliopsoas, which comprises of the psoas major and the iliacus, are really important hip flexor muscles. So those are important muscles for generating power, strength, getting you up those hills, but they can get super duper tight. And especially when you're on the bike for a long time, you need to find ways to counterbalance that with some stuff off the bike, like some good stretching activities, maybe some light yoga, something that you can do consistently and hold yourself to that's going to help you stay balanced. Because we are in this position for a long time on the bike, and that can lead to a lot of kind of tightening up of those muscles. You got your tensor fascia lata here, which I just kind of wanted to highlight. There are more muscles that contribute to this IT band, but the IT band can get really tight and can get super cranky, especially kind of closer down to the knee joint. And some athletes can even have like a snapping IT band or some kind of mechanical symptoms. And that's often from these tight muscles, and basically muscles that are working harder than they need to be working because the other kind of more supporting role muscles aren't doing their job. And then of course you've got the nice massive powerhouse glute max, which is important to continue to strengthen too. And this is all kind of part of this beautiful balance of the hip and glute muscles within the body. Oh, and I can't forget the gluteus medius, very important as kind of that stabilizing muscle, and oftentimes the target of some of the strength training to happen to really kind of keep that knee and knee alignment really on the straight and narrow. Oh, yes, boxes, yes. Okay, next I want to talk about low back pain. So there are different types of low back pain that we see, discogenic and radicular pain. So discogenic is a little bit more focused where it's coming from the intervertebral disc, so kind of the discs of the spine, and I think I have a picture. Discogenic pain here. Sometimes an athlete may have an acute herniation, so where that disc bulges out like so, and that can lead to pinching of nerves. And so the radiculopathy, sometimes you hear sciatica, is that shooting pain down the leg. It can lead to neurologic deficits, so numbness, tingling, weakness. And that's a little bit more serious where you may have to make some more drastic adjustments to either your training, your time on bike, or maybe even take a little bit of dedicated time off the bike just to calm things down. Oftentimes, if it's not a serious radicular issue, the exact pathology doesn't matter as much as the management. And I know that's hard to hear, and sometimes an athlete will want to come into clinic and want some very specific one reason, and oftentimes it's a lot more complicated than that, and it's multiple things contributing to kind of this chronic issue. So a lot of times I have to kind of peel the onion and get down to the heart of the matter, which I'll get into in the next slide. And here's another picture of kind of a herniated disc as well. So any questions on kind of low back or some of this anatomy? I don't want this to turn into a science lecture or med school class lecture. You're not med students. You're not, not going into med school, so you don't need to know all the details of this, but I think it's helpful to understand kind of the potential, some of the anatomy, just to kind of get an idea when these phrases are thrown around. Potential causes of low back pain, again, we're kind of back to bike fit. A lot of times there's being in that greater flex position in the lumbar spine. Sometimes too much posterior pelvic tilt, which I'll explain in a moment, which could be due to saddle position, but also could be just due to posture and flexibility and strength. Changes in saddle bar drop, as you can imagine, and asymmetric weak core muscles. So you can see this greater flex position of this part of the spine here, and that's just causing extra load and compression. Again, I use load and compression a lot with the knee within the back on certain parts of the vertebrae. So this is an old sketch, but a good one. So you can see here the pelvis as it's on the saddle, and how it's a little nicely and evenly distributed, as opposed to this was what we would call more of a posterior pelvic tilt. And you can see how the alignment in the back doesn't look as good, and extra load into these vertebrae. And it's just, a lot of this is related, and I don't know if you guys notice this when you first get on the bike, maybe after some time off, your fit is different and your posture is different and you look a little different. And a part of it is a little bit of flexibility. Part of it is just having that core strength to hold your body into this position. And so it kind of reemphasizes the importance of the strength training to complement the time on the bike, regardless of your level of, or how competitive or how recreational you want the sport to be for you. So straight to the core. There are a lot of core muscles, and core is sometimes it can be very broadly used. When I think of core, I think of the trunk. I think of the abdominal muscles that we usually see, but it's more than just the six pack. There are internal obliques, or transverse abdominis muscles, and muscles within the spine that are really important to just help stabilize the body on the bike. And it's more than just stomach crunches. I feel like there's the old picture or visualization of just doing thousands of ab crunches, and that'll get you the core that you need. But it's really a lot of stability, and a lot of the physical therapists that I work with, they don't really have a lot of focused ab work. It's all integrated within the other exercises that they're doing. And it's nice because I think that allows you to activate the muscles during the right time when maybe you're not thinking about doing just focused ab work. And so that's really what we wanted. We want it to be this habitual kind of those muscles just turn on when they need to turn on. I like this. They say I should learn how to iron, so I did. Power to bodybuilding. Another PSA, kind of switching gears again. I wanted to talk a little bit about just training load management and overtraining and injury risk, and especially during COVID-19. I think that there has been, and I have noticed a shift as far as the epicness of rides, which is awesome, and I am fully on board with that. But I think it should, I think you really have to take into account your own training level and how you can safely introduce bigger loads without dipping into that kind of scary zone. So this is a nice framework of periodization and adaptation to training. And I think we start here with a baseline performance, and maybe it's early in the season, maybe it's after the winter, and you start to introduce more training, and you start to see a dip in your performance, and that's normal. This is fatigue, this is soreness, this is, oh my gosh, I'm out of shape. And ideally, you give yourself a little bit more time, a little bit more recovery, and then all of a sudden you start to dip back up and fall into this kind of resistance phase where you start to get back to baseline and hopefully above baseline, and really kind of have some important gains in fitness and strength. What I see a lot is when people try and hammer too hard early, and this could be with the intensity, this could be with even just days per week, minutes per day, all of the above, too much too soon, kind of going back to that former slide. And they start to drop into this other area, which is overtraining. And so there is an adaptive or kind of a positive training response with kind of pushing yourself to some degree. So there's that like overreaching, and then there's overtraining. And that can present in a couple of different ways. It can lead to an injury, like an overuse injury, the tendonitis, the stress fracture in the runner, or bone stress injury in the runner, or it can just be this prolonged fatigue state. And I think especially right now during these really stressful times where you are getting new introduction to your life, new introductions to your life as far as what your day-to-day looks like, how much you need to be on, like mentally, either through taking care of a young child, doing new housework, trying to work from home with other distractions. And that all adds to the overall stress that's in your day-to-day life. And that needs to be factored in. I call stress a part of training. And that can lead to these drops, and may help explain some of these, like, why am I not responding? Why am I so tired? There are all other reasons for that, which I can get into, but I think you really have to give yourself a little bit of slack here, that or some grace, that we're going to need more time likely to recover from efforts that maybe we hadn't expected before. Happy to answer any of these questions. So I did get a message from a Girls Gone Gravel follower that wasn't able to make it. Laura, what's her name?
I'm forgetting.
Yeah, we'll look it up. I wanted to give her a shout out because she had questions about maintaining bone health as a female cyclist. And I think that's a super important topic, because cycling is not a weight-bearing sport. And there's good reason. I mean, a lot of athletes, they go to cycling because they need to decrease the impact and load that they were experiencing from running. And of course, the risk of stress fractures as a result are very low. So why do we need to worry? And falls are a common injury to competitive cyclists. So I think it's important that our bones are as optimal as possible in case we do have a crash. But I think there has been some decent research on bone health in the cyclist. Unfortunately, there isn't as good of research on bone health in the female cyclist. There have been some studies, but they're all small. And that's the challenge of a lot of sports research. And we're trying to really put in some effort to change that. A lot of my research is more in kind of female runners, high school and from high school to ultra marathon. But I think there is a call to more research on this, because it is important as far as what is the long-term effects of on our bones from cycling. And so there have been cross-sectional longitudinal studies that have shown that high-level competitive cyclists are kind of in a different category than most as far as kind of the dedicated time to the sport, have significantly lower bone mineral density as compared to their match controls, so the non-cycling population. The highly competitive cyclists have lower bone mineral density than the recreational cyclists. And if anybody asks me what the definition or the difference between one or the other, I don't know how they defined it, but I think recreational cyclist is pretty recreational. And I think a lot of the listeners on this are probably more in the higher intensity cycling category when they have the opportunity to. A study of participants who reported high impact cross training or weight training during the study had lost less bone mass than those who did not cross train. So that's the important takeaway for this slide, is that as fun as it is to be on the bike and spend time on the bike, you need to do the maintenance work, just like you maintain your bike, to really stay on the bike more. So the maintenance work includes that cross training, those other types of kind of modified impact or impact activities, as well as strength training. So I wanted to switch gears once again and talk about some different determinants of bone health. And I think it's important just that we are all educated on the female athlete triad and what that really means as a cyclist. So the female athlete triad is comprised of 3 interrelated components: reduced or low energy availability with or without an eating disorder, low bone mineral density, which could be to the extreme of osteoporosis or something more subclinical, and then menstrual irregularities. So that could be a loss of period, or that could be irregular periods or delayed first period for a high school or kind of an adolescent athlete. And so these are things that I see a lot, and it's not just for athletes who are susceptible to bone stress injuries or stress fractures. We see different triad-related problems within the endurance community. And the long-term risks that are not just bone health implications, so kind of a prolonged drop in bone mineral density, but there are questions about the ability to get pregnant and so fertility, as well as other systemic effects. So I just wanted to use this nice cumulative risk assessment tool because this is what we use in my clinic for athletes who come in and that are a female athlete. I try to factor this in when an athlete comes in for a sports physical, or if they do present with an overuse or bone stress injury, and I am concerned that the female athlete triad could be a potential factor. So this just takes in all of these risk factors and allows us to provide place a score or create a score that categorizes an athlete as low, moderate, or high risk. And that can help us provide some guidance as far as our recommendations. And oftentimes the recommendations is targeting the energy availability. So if there is an energy mismatch so that the training isn't matched, if the fueling isn't matching the training, that can lead to a disruption in overall kind of hormonal balance. And that leads to drops in estrogen in particular, which estrogen feeds into the bone is the easiest way I can describe it. And that contributes to bone remodeling. So bone breakdown is higher when the estrogen level is low, and bone building or bone formation is lower. And so this is really important for the cyclist as well. And so I know there have been some great talks about fueling on the bike and really thinking about how you refuel and how that's going to not just affect your performance and ability to maintain a good energy balance or energy level, but it's also important for just overall hormonal and systemic or in kind of body function. I did create this infographic a few weeks ago, and I wanted to share it. Mainly, there are a lot of questions, and I know I don't think that we have any high schoolers in this on this talk, but listening. But I get a lot of athletes that are in their high school years, and they talk about other athletes within their team who lose their period during high bouts of training. And some of these are runners, but I think any endurance sport really they can be at risk. And I think it's important to just that we all know that losing periods during heavy bouts of training isn't normal. And oftentimes different types of hormonal replacement can kind of mask the convenience or ease of having a period as kind of that marker. So I'm not advising against using any type of hormonal replacement, but I think you need to factor that in your ability to really track your fueling patterns. And regular periods while on oral contraception doesn't mean that your hormones are functioning at 100%. So if anybody wants this infographic, I'm happy to share, but it's just it's pretty simple, but it's these are important messages to really relay, especially if you're working with younger female athletes. I think it's important that they understand that it's not normal to lose their period during heavy bouts of training. And if they were placed on the pill or the birth control pill for reason alone for irregular periods or for that reason, they're probably missing a bigger an opportunity to kind of dive into some other underlying issues. I want to give time for Q&A. So This is just another example of how this low energy availability can affect multiple functions, including just overall like immunology and ability of to fight off infections, GI, cardiovascular, and performance. And it affects males too, except the only difference is males don't have periods. They get this nice diagnosis of hypogonadotropic hypogonadism, it's a mouthful. So quick take-home points on bone health. Laura was able to visit one of actually the gym in this facility, and was had a nice weightlifting session. So I think it's important to match caloric intake to your training volume and intensity, which is going to be variable throughout the year, especially throughout different seasons. Really focus on maintaining menses. I know that's more difficult when on different hormonal contraception. So I'm happy to answer some of those questions if you have them. Ensure optimal mineral intake, calcium and vitamin D and vitamin K. Incorporate weekly higher impact cross training and resistance exercise. And some strength training tips include, so almost every physical therapist that I ask states that cyclists and endurance athletes need to lift heavy things, period. American College of Sports Medicine recommends strength training twice a week. Aim for 2 to 3, maybe you'll get 1 to 2. Some examples of different weightlifting. This is also came from one of 2 physical therapists, and they both agreed. I just asked them yesterday just to confirm. They recommend compound lifts like squats and deadlifts, so kind of actually doing some weight work. Single leg stance work to work on proprioception and just that single leg strength. And if you want to incorporate more of a power component like swings and cleans, that's good too. Lower sets and reps, 4 by 6 at an intensity or difficulty level of 7 to 10. I will say that I am not a strength and conditioning specialist. I work with experts, expert physical therapists. I have one of them who kindly said that he would be available via text if there are some specific questions, so that I can shoot him a quick text message if I don't have the answers. But now let's chat. I've been talking a lot. I'm sorry this came off so much of like a lecture, but hopefully there's some takeaways, and we can just have some good discussion now. If you want, I can stop sharing my screen so I can see everybody.
Thanks, Emily. A couple questions came through on the chat. It says, any advice for those who suffer from hypothyroidism? And then the next question also says, menopause and hypothyroidism. Are there any suggestions on these?
Yeah, I think I've had a couple of athletes who've come in with thyroid related questions, and I think there are a lot of endocrinologists who are experts in thyroid dysfunction, but don't always know how to work with the athlete with some type of thyroid disease. And I think the athlete needs to be a lot more in tune with what energy levels or changes in energy levels mean. So it isn't just maybe an overtraining or a fueling issue. It could be kind of adjusting the dosage if there is a medication involved. I also see some athletes that, because of fueling errors, whether they are just not matching, or maybe even the timing throughout the day isn't as optimal as far as when they're fueling, they can start to have drops in some of their thyroid levels. And so that can potentially mask some of the other kind of more, it can affect, I almost don't recommend trying to treat that with a thyroid replacement before addressing some of the other issues. So I guess credit to the people who are dealing with thyroid dysfunction. I think you have to be more on top of things as far as fueling, training, recovery, and how you approach your training throughout the year, so you don't dive into that overtraining or acute load. And menopause is another challenge, and I think my big takeaway, and there isn't a lot of great research on bone health, menopausal, perimenopausal athlete, and how you need to adjust your training, especially on the bike. And I think, of course, fracture risk does go up, and as estrogen kind of drops, that is going to lead to drops in bone mineral density. However, I think really kind of going back to that, emphasizing the resistance exercise and finding ways to actually be a little bit more on top of that, and maybe even spending a little bit less time on the bike, a little bit more time doing resistance work is going to it's going to kind of save off some of that, or kind of take away some of the drops that could happen with menopause, drops in bone mineral density.
Do you see the question from Alex? Hi, Alex.
Hi, Alex.
Vitamin C, D, and K, are they good to take? Do you recommend?
So I'm always really hesitant on blindly recommending supplementation. So whenever you can try to get something from your diet, I encourage it. Certain times of the year, vitamin D especially, it would be recommended just due to kind of our exposure to getting daylight and getting sunlight. And so wintertime, sometimes I do encourage a vitamin D. I think we spend on the bike, we spend a lot of time in the sun, and it doesn't require a lot. However, I think a 1,000 IU vitamin D3 daily supplement, if you're going to supplement, isn't extreme, and especially during the winter months. What you don't want to have is to have these drops and these vitamin D levels in the even just insufficient range. And I can try and give you some better resources. I have a sports dietitian that I work with, and she has a nice list of supplements, kind of the good supplements versus the bad supplements, and how you kind of distinguish between the two.
Thank you.
I have a question. This is Katie. Back when you're talking about knee pain, so if you're dealing with knee pain, do you have suggestions for how to figure out, do I deal with bike fitting issues? Do I go to a PT? Do I go to a sports medicine doctor? Like, where do you start to kind of try to figure out what the issue is?
Yeah, so if it happened kind of coinciding with like some first time on the bike, whether it's a different bike that you haven't been on in a while or a new bike, you may want to think, okay, is my bike fit a little bit off, or am I I'm not used to being on this bike? But if it's kind of more like a couple of months in and you're starting to experience knee pain, then it could be more of something not bike related. And then I would probably recommend initially a sports medicine doc if you have that access, and then going to physical therapy, so that way the sports medicine physician can kind of tailor the physical therapy recommendation. And that will kind of also help you, they'll walk you through some exam maneuvers that can help decide, is this kind of between the patellofemoral joints, so kind of that contact, or is it more on the outside, kind of more IT band? Sometimes there's a combination of both, and that can really influence a couple of some of the finesse and the fine tuning of the PT prescription, physical therapy prescription. I also didn't really mention, as far as I get a lot of questions about like body work and chiropractic work and massage therapy, and I think that they can play a good role as far as an adjunct to a strength training program, but I don't think they should really replace.
Emily, how often do you suggest like stretching and foam rolling type protocol?
Yeah, so I know it's hard, especially on the bike. We like hop on the bike and we just go. But if at all possible, first of all, kind of taking the first like 5 minutes, 10 minutes and really warming up. Or if you're really on top of it, actually doing a good like dynamic warm up, getting the legs moving off the bike, swinging the legs, maybe even kind of going into some like Cobra, and just kind of not just hopping on the bike, and then, because then you're in that position for potentially hours. How many of you have been on like halfway through a bike ride and all of a sudden you finally sit up and you're like, oh my gosh, that feels so good. So make sure that you keep mobile and keep moving. And I think it's really important to on the bike, like making sure that you do some mobility and some kind of flexibility throughout if you can. As far as foam rolling and then the body work piece, I mean, this is where things get really fuzzy as far as the research goes. So I think you kind of need to figure out a routine that you're going to stick with. But if you can do a little bit of body work, when I say body work, I mean maybe taking a tennis ball to the glute, or taking a tennis ball to the low back, to kind of just, it's going to feel good. And it may just kind of balance out some of the counteractive forces that you were experiencing while on the bike. I mean, ideally every time, like especially on those long days on the bike, ideally afterwards. I know that's the last thing you want to do is do something. You just want to shower and have a good meal, but maybe while you're refueling, you can be sitting, kind of doing some foam roll. So ideally after those longer efforts, you should be doing some. Otherwise, the next morning you're going to be pretty stiff.
What do you think about those new like trigger point gun things? I don't know what they're called.
They're fancy, they're expensive. I don't think that I'm not going to demand everyone go buy a several $100 point gun. I think that you can find some toys at home that can work just as well. And there isn't strong evidence that says that that's necessary to really, definitely not to prevent injury. It may prevent some DOMS, or so delayed onset muscle soreness, but I think there are a lot of other ways that you can do it that are a little less expensive.
Thank you.
I try to keep it simple, so I don't want people like taking us like, okay, I have to do the strength training, this, and then I have to do the yoga and do all this. If it gets too complicated, we're not going to do it, and we don't have enough time. I mean, we're already on the bike so much, so find a routine that works for you, keep it simple, and stick to it.
I have a question on the strength training side. So there is, so it's always lift heavy is always the answer, which I feel like, granted, there's a progression, right? But there is like a diminishing return, right? Where you get to some point in strength and then your bike performance will go down because you can't recover from your strength. So is there like, one, how would you define lift heavy? Which again, I know it's a progression for people, but then like what's the balance like there?
Oh, this is such a great question. And I'm actually texting Derek right now because this is new for me. I always thought like, oh, runners and endurance athletes they can just do body weight exercises. That's good for you. Like you're doing strength work. But the more I talk to Derek, the more I realize that heavier lifting and kind of actually doing weight training has a lot of kind of protective benefit. And although there may be a small dip in performance, he argues that that dip will resolve and you'll probably respond better in another week or two. So I think like you want to introduce the timing during a time where you're not like at the peak and going to compete. Ideally, honestly, now is a really great time to start to build that foundation. But as far as the specifics, I'm going to get back to you because I feel like anything that I try to provide as far as kind of what is heavy lifting isn't going to do it justice. I'm trying to pull up a slide that he provided to see if that gives me some.
I think it's like part of it is, and I used to work like as a trainer, and lift heavy means different things for different people. But I've also found like I can get to where I'm like doing a around 200 pound deadlift and, you know, like 125 squat, and that does it for me. But then my friend Cassie, like she does a 300 pound deadlift and a 250 pound squat. And I'm like, well, that's good. Like when I look at her, that's lifting heavy, you know, but then some people will go, well, a 200 pound deadlift is heavy, you know, so.
Yeah, I think you're right. And I think it's so unique. It's people's comfort level. And I think honestly anything, and this is probably what Derek would say too, the fact that you're lifting is a great start. But I think when you start to fine tune it, and especially like with when you're more experienced, then you can start to get into those heavy lifts. So I think when it gets to be those greater weights, I think you have to be a little bit more deliberate as far as what like the timing, and whether it's the timing of like when you do it throughout your week, making sure that you're not doing like a long ride the next day. or it's the day after a long ride. I think you can be strategic as far as kind of getting the gain, as much of a gain as you can from the strength piece, while still not compromising your effort on the bike.
Yeah.
But I'll try and give you
the hard way. Do not do lots of deadlifts the day before a very hilly bike ride. Just not good.
I think I saw another question. Hydration pack. That's a great question. Do you know how heavy the hydration pack is? It like a pretty, because some of them can be, it depends on the hydration pack, I think, as far as the amount of weight that you're taking on. But like a Camelback, for example, I think the actual weight of the pack probably isn't as much as opposed to just how the weight, it's the perceived weight that you have. I think that we can really tense up in certain parts of our back and our posture, and we may not realize it. So especially for those water packs, I think really making sure if you can adjust it so it's not resting on your traps. It looks like you're complaining more of or describing more of the low back pain. And so you may even be feeling, or you may be actually tightening up more so on your low back too. It'd be interesting to see what your posture looks like with the pack and without the pack, and if that does make some changes and actually just creates a lot of extra strain. A lot of times when I have athletes that complain of low back pain on the bike, sometimes it's just from those muscles fatiguing out. And through time, and so it might be what you should do is start to maybe wear the hydration pack on shorter rides, just to kind of practice kind of having that extra weight, so that way you can tolerate it more so on the longer rides. So it's kind of like training for anything else, kind of like saddle time too.
Emily, if people want to get in touch with you, or I know you just started a second Instagram, so
yeah.
I would suggest that you guys follow Emily Kraus MD on Instagram, or your new account is Emily. What is it? Can you remember?
Emily Kraus MD _ sports science. To try and like keep my sports science related topics in a better way. But I'm trying to have telehealth available out of state. So if you are really struggling to find somebody to talk to about some of these injuries or aches and pains, or if you have friends, we're trying to find a way to make the telehealth work. So, and I do make athletes do some fun video maneuvers. So it's not the same as putting your hands on a patient, but especially right now during these times, it's better than nothing.
Well, thank you so much.
Yeah, thanks for having me.